All right, time now for this week's injury report, being brought to you by Cape Regional Health System and Dr. Kevin McHale. Cape Regional Health System and Penn Orthopedics, the best of both worlds for a healthier life. For an appointment, 609-463-CAPE, or visit caperegional.com/orthopedics. We were hoping we'd never have to talk about this guy, Doc, but sadly, Carson Wentz is on this week's list of injuries to discuss. A torn ACL. He is out for the year. So I know we've talked about them way back in the beginning of the season. Guys have done this. But when you have a player of this magnitude, we got to kind of go over it once again and just kind of give people some insight on why is this injury so devastating and that it keeps guys out for what they're saying 9 to 12 months.
Yeah, this is absolutely a devastating injury for the Eagles, and I think Nick Foles will be a good, capable backup quarterback. But obviously, we didn't want to be talking about Wentz this year. He's playing like an MVP. But so these injuries in general, we're talking about a very important ligament in the knee called your ACL, and it's in the middle of the knee, and it provides stability to allow you to kind of cut and pivot, which all these elite athletes need to do. Most of these injuries are non-contact injuries. They plant a foot to kind of cut and change direction. It puts a lot of load on the knee, and actually the femur kind of slides on your lower leg, your tibia, and it tenses that ligament, and it can tear if there's enough force going across it. Now, Wentz apparently had a much different injury. It seems like it happened during that collision, and it might have just been that the way those two guys hit him put that force across the knee joint just the same way, where it put a lot of tension on the ACL and tore it. Honestly, we're actually he dodged a bullet, and that these kind of injuries often are, when it's that kind of trauma, often are associated with other ligament injuries, kind of like happened to Jason Peters at the beginning of the year. We talked about the ACL, MCL. We saw this in the past when Tom Brady got hit on the side. He had an ACL, MCL injury. So these multi-leg injuries are a bigger deal, and it seems like he really dodged that, and it's just the ACL. But you have to reconstruct it with a surgery, and it's a lengthy rehab to get him back to full strength.
Yeah, everybody kind of, mentions that Adrian Peterson returned, that he came back and was the MVP of the league. But realistically, this happens in December of 2017. I mean, do you see Carson Wentz September 1st week of the year being ready to play with this injury?
It's definitely possible. So in general, we always use the timeline 9 to 12 months to get these players back on the field. And it's unfortunate that it happened this late in the year, but it's definitely possible. We actually had this happen to McNabb back in November of 2006, and he returned to play by the second game of the preseason the following year and did fine after that. Now, in general, we may not see him in the preseason or definitely not the start of the preseason, but it's definitely possible that he'll be on the field at the start of the regular season. The question is he going to have the mobility that he has right now? Does he become a little bit more of a pocket guy in the beginning while his mobility continues to improve over the beginning portion of the season? The good news is, though, that after these ACLs are reconstructed and the rehab's complete, people do very well. We look at other guys in the league, McNabb, Tom Brady, they had very, very good seasons after they came back from our ACL tears. Obviously, they missed those seasons, but then they came back and played at a high level, and we see it all across with these other, other position players as well. So I don't expect to see it. I think for the long term, the duration of his career, I think he should be a very high-quality quarterback. It's just really unfortunate that it happened this season.
So minicamp is 6 months away. I guess he obviously could be throwing by then. Training camp is in late July. How long after the surgery does that ACL keep improving? That you could maybe be out there doing things, but I mean, even if he's on the field, is that ACL still kind of improving even when he is cleared to play?
Yes. So in general, there's actually some studies that say that this might continue to improve for a full 2 years after the surgery. So it absolutely continues to heal. And when we do this reconstruction, typically we take a little plug of bone on each side of the patellar tendon, and we use that to reconstruct the ACL. And that bone continues to incorporate with your body's bone to make it stronger and stronger over time. And also just the conditioning of the athlete itself and building up his own strength, because they have such a big setback. They're at such a high level right now with conditioning, and then they go through the surgery, and it really puts a wrench into things, and they continue to strengthen from that standpoint as well. So absolutely he'll continue to improve throughout the season next year, but he should be on the field at least doing some sports-related drills over the summer. He might even be thrown by OTAs, but definitely by the preseason doing a lot of the drills, even if he's not released for game action.
Now, he can, as we saw, you mentioned McNabb. He came back. He wasn't really himself. He was out there, but he wasn't really himself. We've seen this a lot where guys are out there, but they're not really, is that mental for a lot of these guys that they just can't, let her rip?
Yeah, well, it's a combination. Some of the more mobile quarterbacks, they're not themselves because they don't literally have that mobility yet that they used to. Some of the pocket passers do a little bit better because they're able to just kind of stay in their pocket and still go through their reads and make their throws. A lot of it is mental. A lot of it is retraining. The mind to just not be afraid of that next hit. But honestly, with Wentz, I'm not concerned. He played 3 plays after that torn ACL, threw a touchdown pass. He's a tough guy. I think he's going to rehab just fine and get back out there. Whether he's going to be the exact same player week 1 of the next season, I would doubt that. But I think he'll go back to the same level that he is at some point in the near future.
Okay, I want to get your thoughts on Rodgers playing this week. It sounds like if he was not on the injury reserve list, he would have rather been ready to play a couple of weeks ago. He just wasn't able to because they put him on the IR. There's a lot of people concerned about, re-breaking this. Are you surprised that he is going to be back playing this weekend?
When you're talking about these guys at that level, there's a risk-benefit ratio with everything, and at this point, there's obviously a significant risk of refracturing that clavicle. It's a real risk. We know there's a higher recurrence rate earlier when you get back to activities at an earlier time period because it's continuing to heal. Obviously, he has 2 plates and a lot of screws holding that together, and that gives him a lot of support, and that will decrease that risk of refracture, but it's a definite possibility. Now, if the playoff chances for the Packers were completely out and they didn't have a chance to make a run for the playoffs, you could be sure that he would have stayed on the IR, most likely to protect them, to let that heal a little bit better. But with the chances that they have to actually make a run for the playoffs, I'm not surprised at all that he's going to be on the field. The problem he actually played amazing after he returned to the field. I think he threw over 300 yards after his non-throwing clavicle fracture when he missed 7 games and got back playing. Right away he played at a high level. The problem this time, though, is that it is his throwing shoulder. So I wouldn't expect him to be playing exactly at that high level. Obviously, the Packers organization thinks he's going to be a big upgrade over Hundley, and I wouldn't be surprised if he is. But I think he will be playing at a high level. It's just going to be maybe not the Aaron Rodgers we're expected to see for a couple of weeks as he continues to heal.
Okay, last one we're going to do baseball. This was a big free agent signing. It's been big news. Shohei Ohtani signed with the Angels, and after he signed, they found he had a first-degree sprain of the UCL ligament in his right elbow. Anything to be concerned about here? I had heard something about, they got that plasma shot in there, something similar to, I think, what Embiid got in his foot when he went overseas. But anything here to be concerned about with the sprain of the UCL for the pitcher?
With a first-degree sprain in the off-season, I don't think there's really anything to have to be concerned about. So first of all, the UCL that we're talking about is the ulnar collateral ligament. It's the ligament on the inside of the elbow that plays a major role in stabilizing the elbow, especially in throwing athletes, particularly pitchers. I mean, he throws a 100-mile-an-hour fastball. To generate that force, if you ever watch these guys in slow motion, there's incredible torque that goes across the elbow, and it stretches that ligament on the inside of the elbow. Now, in general, most people, nobody puts that kind of force on that ligament, but these pitchers do every day, many, many pitches, which is why they have to pay a lot of attention to pitch counts and resting the players to make sure they protect it. I can't imagine that. I'm not surprised at all that he has a sprain there with the amount of force he's putting across there with a 100-mile-an-hour fastball, but they do very well with non-operative management with PRP injections, rest, and a focused rehab program to strengthen the muscles that surround that ligament. And I wouldn't be surprised if he's, full tilt by the time spring training rolls around. The problem is for him, he's a young guy, and pitchers, we see ulnar collateral ligament issues becoming more and more common. I think about a quarter of pitchers have a reconstruction surgery at some point in their career. So I wouldn't be surprised at some point if it becomes an issue. But a first-degree sprain with this amount of time before the season getting started, I don't think they have anything to be concerned about.
A lot of injuries. Unfortunately, the big one is Carson Wentz, and we'll certainly update him throughout his process with, man, I can't believe we're talking about Dr. James McHale, of course, over at Cape Regional Health System and Penn Orthopedics, the best of both worlds. For an appointment, call 609-463-CAPE or visit caperegional.com. Boy, I can't believe it got to this. Kevin McHale here on, did I just call you James by accident? I'm sorry about that. Kevin McHale here on the Sports Bash Live on 97.3 ESPN. Heartbroken. Many of us are, but good breakdown of Carson Wentz, and hopefully we'll have good news throughout his rehab on this. Thanks, Doc.
All right, no problem. Hopefully next week we'll be talking about some other teams.